Talk plastic surgery now. You know, according to the American Society of Plastic Surgeons, in 2006, liposuction and breast reduction were among the top 5 cosmetic surgical procedures among men.
The American male grooming market is now worth $3.5 billion. So let's face it, a lot of men out there, they want to look good, and some of them are willing to go under the knife. So before we show you this story, we want to advise you that some of the footage you're about to see is both revealing and graphic.
My name is Dr. Stephen L. Davis. I'm a board-certified plastic surgeon in Cherry Hill, New Jersey. Men are having plastic surgery these days in greater number, basically because they're starting to realize that they really can make a fabulous difference in the way they look. It can be as minor as little injectable type things, all the way up to actually having some pretty major surgery. Some guys are just born with having male appearance to their chest, but they start to get a female appearance to their chest around the time of adolescence, and that's called gynecomastia. Does the feel of the skin and everything seem back to normal?
It does. It does. I'm Robert Hackstetter, 35 years old, and I came to see Dr. Davis to have my follow-up on a procedure I had done that removes fat in my pectoral area.
That looks fantastic. Good for you.
I lost weight of about 50 pounds, and I thought maybe that would, strip off some of the fat and my problem areas. And ultimately, in a way, it made my condition and appearance more predominant.
The gynecomastia procedure can sometimes be as simple as just straightforward liposuctioning. Other times, it may also include having to make a little larger of an incision and actually remove some of the breast tissue.
It was like hidden in my clothes a little bit, and I'm not walking around worried about my appearance.
Guys are coming in saying, look, I'm in the gym all the time, I just can't get rid of this fat. In those cases, a tummy tuck is probably the best operation for them.
I go right in here.
Oh, thank you. David Aaron, I'm 44 years old, and I had abdominoplasty done 2 weeks ago. I went from 325 plus to down to about 200 pounds. Unfortunately, I did have a lot of relaxed skin in my abdominal area that through continued exercise and diet wasn't going to go anywhere.
We do end up making an incision pretty much from one hip across to the other hip, and it allows us to go all the way up to basically the rib cage and pull all that extra skin down, and now they're left with this very tight wall, if you will, of muscle and everything else. But that is a procedure where they're going to have some drains that are left in place. We're going to make sure that this is all good.
There's one remaining drainage device on my right side, which is goes in a couple of feet into my abdominal area, which drains fluid, blood, and excess stuff into a tube. Because it's coming from inside of you, and it your body kind of grows around it a little bit for the last 2 weeks, and you can kind of feel it tugging and pulling on some things. This type of surgery is something that's perfect for a lot of men in my age class.
That looks really terrific.
Well, he looked better. I mean, he definitely lost a lot of the stomach. He lost the weight. He did what he was supposed to do. Just couldn't get the rest done. Whether you are male or female, if you have cardiac problems or are severely diabetic, then surgery may not be a good option for you.
Yeah, but it is nice to know it's out there, especially for people like the first gentleman who lost a lot of weight and then actually exacerbated his problem of having larger breasts.
Yeah.